certainly the best.
Thank you very much for joining us on the program, Healthy Living.
What is the kidney?
The kidney. Thank you for joining us today on the program Healthy Living. Amadesuwa Osa Owagye. Cervical cancer is one of the causes of death in women globally, and it is of a significant concern, especially in low and middle income countries. In 2022-2023, there were an estimated 660,000 new cases and 350,000 deaths worldwide, making it the fourth most common cancer in women. The highest rates of incidence and mortality are in sub-Sahara Africa, Central Africa, and Southeast Asia. In Nigeria, cervical cancer is the leading cause of cancer deaths amongst women, with many cases going undiagnosed or untreated due to limited access to screening and treatment services. And of course, we know that majority of women want to have things free, especially when it comes to health. So it is this that has brought us here today to talk once again on cervical cancer. We're trying to create awareness. And joining me today on the program is Dr. Victory Uzoma. She is the founder of FemCare Initiative, an initiative that deals on taking care of the women issues. And they've been doing so much on cancer. So she's here to create awareness for you and I yet again on this issue of cancer. All right, you can see that about 660,000 new cases, and of course 350,000 deaths globally, and many of these go undetected, undiagnosed, and untreated, and the women will just go like that. So we don't want any woman to go just like that, okay, when you can get help. So Dr. Victory Uzoma, thank you for finding time to be with us on the program.
Thank you so much for having me.
All right, talk to us about cancer, cervical cancer. What is cervical cancer? Where is it usually located?
All right. So cervical cancer is the cancer of the cervix, right? So cervix is a part of the uterus, that's the womb where women like give birth, right?
Yes.
So the bottom part, that's the tip of the womb, is called the cervix. So cancer of that area is called cervical cancer.
Okay.
And then it affects women because women are the only ones that have the cervix. Yeah.
That's fantastic. Okay, what are the signs and symptoms?
Okay, the signs and symptoms of cervical cancer include discharge, foul-smelling vaginal discharge, bleeding during sexual intercourse.
Is it every foul-smelling vaginal discharge that should be checked?
Yeah, yes. If you have smelling vaginal discharge, you should see a doctor. But it doesn't mean that every foul-smelling vaginal discharge means you have cervical cancer. But it is one of the symptoms to look out for. And also, painful sexual intercourse is one of the signs as well. And then bleeding during sex, pelvic pain, these are some of the symptoms. But then with cervical cancer, most of the symptoms appear late. So in the early stage, most women do not present with any sign or symptom. So these are like the late signs and symptoms of cervical cancer, which is why we advise women to screen early, because most times when they have these symptoms, it means that it's already in the late stage. Yeah, that's
so once the symptoms appears, it means it's already in the late stage?
Yes, because usually it doesn't have any sign or symptom in the early stage.
Okay.
Yeah, so once it progresses to the late stage, that's where you find these signs and symptoms.
Find out the symptoms.
Yeah.
Okay, what could be the cause or causes of cancer?
Okay,
because to date, we're still looking for.
Yeah, cervical cancer, the cause is the HPV, that's human papilloma virus,
Okay.
Right? So this is the major cause of cervical cancer, and it is transmitted through sexual intercourse. You get so cervical cancer is largely associated with HPV, that's the human papilloma virus.
So the man is a carrier, is that what you're saying?
I would say so, because it is transmitted through sexual intercourse. The men usually have the HPV, but it doesn't present as cervical cancer because they obviously do not have cervix. So for the men, it presents as anal cancer, penile cancer, but for women, it presents as cervical cancer. Yeah.
Okay, since symptoms appear when it is already getting late, any remedy when there is when a woman presents with all of those symptoms that you talked about, like abnormal vaginal discharge, bleeding during sex, unusual vaginal discharge, pelvic pain, pain during sex, and all of that? So before all of this, what can a woman do to save herself?
Before this, it is important that every woman gets screened for cervical cancer, right? Especially if she's sexually active. So for women who are sexually active, you should go to the hospital to get screened for cervical cancer, whether you have the symptoms or not. Because like I said, it usually do not present early. Right, so when they start having those symptoms, it's usually a sign that it could be like a late phase cervical cancer, right? So even for young girls, we advise them to get vaccinated because the vaccine is usually taken before you're sexually active. So to prevent yourself from having the cervical cancer caused by HPV, we advise women to get the HPV vaccine, like young girls rather.
Who are not sexually active,
usually advise between the ages of 9 to 15. To get the vaccine. And then for women who are above that age and who are sexually active, they should get screened regardless of whether you have the symptoms or not. You should get screened. Okay,
tell us about screening now. What does the screening entails?
So for the cervical cancer screening, a woman gets to the hospital. There are different types of screening, right? So we have the pap smear, there's the VIA screening, that's the visual inspection with acetic acid, and then there's the HPV DNA testing.
Okay, tell us about the three.
So for the pap smear, which is the one we are very much used to, that's pap smear. So you go to the hospital, they get samples from the cervix, and then take it to the lab to check if there's any abnormal cell there. So same thing for all of them, but they are just different methods. So for the VIA screening, that's visual inspection with acetic acid, it's still the same procedure, but then the acetic acid is placed in the cervix, and then if it turns white,
is it injected or this?
It's not injected. It's just like you use it to clean the surface of the cervix. Right, and then you check out for
the cervix is not an open area. I mean, that means they have to go inside
just like
the cervix.
The woman sits like she wants to deliver, right? So they use a speculum, right? The speculum to check the cervix, and then use the acetic acid stained with cotton wool to clean, and then you check out for the abnormal sign. Usually in low resource settings, especially with outreaches, this particular method is usually used because you get your results there and then. So they check
so it's quite effective.
Yes, it is. So it is cheap, it is effective, it's a WHO approved method for screening. And then you check the cervix. There and then you get your result. But for pap smear, you take it to the lab and then it might take some days to get your results. Then same thing for the HPV DNA testing. Sample is collected, then they take it to the lab and check if there are any abnormal lesions there. I'm
usually interested in all of this when it comes to costs. How expensive are all of these tests?
So for the three methods, VIA screening is usually the cheapest because it doesn't require much. Right, these materials are usually readily available, but for the cost, that's usually between 2,000 to 5,000 naira. It also still depends on the facility. So for a private facility, it will cost more than that. I can't really say how much, but it's more expensive in private facilities.
But in government facilities,
for government facilities, it will be 2,000 to 5,000 naira.
But it's not
definitely
much.
Less than
it's
10,000.
not much.
Yeah, it's not much, but there are a lot of women that they struggle to take care of their family, for example. Imagine you having 5 children and they are thinking of school fees, thinking of what to eat. So cervical cancer screening is not what comes to your mind at that time. You get so they have more priorities to look out for. So So that's why we, many organizations, especially government as well, they carry out like free screening for women, so they don't have to worry about the cost.
Okay, talking about the family and all of that, shouldn't a woman prioritize her health?
Yeah, but you know, this is Africa, this is Nigeria. Like in Nigeria, most times, like women have to look out for every other person first.
Before themselves. No, it's about
Yes.
time a woman started taking good care of herself, for goodness sake, because all of this tests should be done early, because when you don't and one disease or the other set in, that same family you're trying to care for will care for themselves.
Exactly.
And then the woman might just be left alone somewhere in one room to take care of herself. So a woman should prioritize her health regardless of whatever she's going through. A woman can afford to buy a dress of 150,000, of 200,000, but finds it so difficult to buy PCM for herself. Is that not funny?
Yeah, it is.
So
but
please,
like,
as a doctor, I need you to talk to some women now. They need to prioritize self-care, health.
Have to. And the good thing about this screening is that it is done once in 3 years. So if you carry out the cervical cancer screening now, you don't have to worry about doing it every time. So the next time you check is like 3 to 5 years time. So it's not something you do every month or every year that will now drain your finances per se. So like once you get it done this year, you know that okay till 3 years.
For another 3 years.
Yes, so that's it. So women have to know about cervical cancer and know that they need to get screened for it. You don't have to wait for any symptom. You don't have to wait for anything, and then they should prioritize their health over.
All right, the program is Healthy Living on Independent Television. We'll take a short break, and when we come back, we will continue. Just stay tuned.
Some days, there comes the Ugemobo Festival, which the Oba celebrates outside the palace gate. A pavilion is built of red cloth where rites are performed to drive away all evil spirits still unsatisfied by the year's sacrifices. The Emobo Festival is to commemorate an event in Benin history which dates back to 1504 AD.
Yari yari, Oba Tope!
Thank you so much for joining us again on the program Healthy Living, and we're talking about cervical cancer. All you need to know, at least some of the major things you need to know about cervical cancer, and I'm talking with Dr. Victory Uzoma, the founder, FemCare Initiative. Okay, Dr. Victory, let's look at treatments now. What kind of treatments can a cervical patient get?
Okay, so for the treatment for cervical cancer, the treatment is dependent on the stage, right? So, like I said, cervical cancer needs to be detected early. So if detected early, some of the treatment include cryotherapy, which is using cold to freeze the abnormal cells. There's also thermal ablation. But then for late stage cervical cancer, you can now have chemotherapy, radiotherapy. So basically the treatment just depends on the stage. So even if a woman now sees that, okay, she has this symptom, she needs to also go to the hospital.
Like how many stages first before you go on?
Stages. There are like 4 to 5 stages. So like staging of cervical cancer is different, but then on a general note, we have like the early and then the late stage.
The late stage.
So if a woman detects it early enough, maybe through just going for screening and then she detects it, that's like the early stage. So she would get.
So at the early stage, is it possible to get some cure?
Definitely, it is. It is. The cure is definite with the early stage, right? Because at this stage, the abnormal cells are few, right? So it's easy to kill the cells before they get like spread to other parts of the body. right? So, but for late stage, most times that's even gone beyond the cervix and then expanded to other aspects in the body. Yeah.
Okay.
Yeah. So even myomectomy, hysterectomy is another way that's
surgery now.
Yes.
Like that's like a permanent cure.
Uterus, yes. They remove the uterus, but then that's still dependent on the stage. If it has expanded beyond that, hysterectomy alone would not work. So you now have to do like chemotherapy as well as hysterectomy and then radiotherapy. So it's a lot. And then this is very much expensive. So which is why we always say prevention is better than cure. So instead of waiting to get to this stage, you now start having to pay for these treatment options. You still have to spend money. So the money you're trying to prevent from not, like you don't want to spend money, so you don't want to
save.
Yes, you're trying to save by not going for screening. But if the woman comes down with cervical cancer, she has to still spend the money. So, and she will even spend more. So it is very important that we take screening and vaccination very serious.
Okay, I don't know how true this is. Obviously, it's just mere rumor or a fact that cancer treatment generally hurts the woman even more. Like breast cancer treatment, cervical cancer treatment, the chemotherapy and all of that does a lot of damage to the woman rather than curing the woman. How true? Okay,
so while treatment is very much possible, and then like there are still side effects regarding cancer generally, even cervical cancer. So first of all, once a woman is being diagnosed of cancer, regardless of the type, there's this fear of death. Will she make it? What will happen to her children? Who will take care of her family? So that one already gives her this emotional and mental stress,
yes.
Right? So that's for that. And then the treatment itself, like the chemotherapy, they can come down with some side effects like loss of hair, nausea, you understand? So like these are some of the side effects accompanying the treatment. But generally, the diagnosis itself, there are so many side effects. Even financial stress, like it drains the finances of the home. Like you see people selling properties, selling land, selling everything just to ensure that they get the treatment. And some of them do not make it because as at 2015, maybe 2012, it was recorded that over 12,000 cases. 12,000 cases were recorded, and then out of the 12,000, over 8,000 deaths. So it shows that like there's a high rate of death associated with cervical cancer, which is why we prioritize screening and vaccination. And then this is very much preventable. I think cervical cancer is one of the most preventable cancers.
Please tell us.
Yes, because from the screening and vaccination, it is very much possible to prevent cervical cancer, you get. But for other cancers, for example, breast cancer, you do not have vaccines for it, you get. So from age 9, we already start vaccinating the girls, even boys as well, because like I mentioned earlier, they are predisposed to other cancers like anal cancer. But for women, cervical cancer is something that we should like prioritize, like screening and vaccination. Yeah.
Which is not so expensive.
Not so expensive.
Okay, talk to us. How can somebody who is already taking cancer treatment cope with the side effects?
Okay, so for patients who already have cancer, like it can be a difficult period, like getting to take medications, the fear of what next, then the financial stress associated with it. So one of the ways they can cope is having support, right? So the family needs to be there for them. Because some women, if you hear them speak, they'll tell you they are scared, like they don't know if their husband is going to like go outside to like maybe cheat because they are not fine, they can't have sex, do you understand? So these are some of the fears they have. So they need genuine support from the husband, from family members, financial support, moral support, and the government will have to create like a support group. They have to be like support groups to help women who already have cancer to cope better. Because sometimes it's even the mental stress that make the healing process even worse.
Very difficult.
Yes, because like there's so much to think about. Like you don't know what next, you don't know whether you're going to die, you don't know this. Then there's the shame of people knowing that this woman has cancer or that kind of thing.
Stigmatization.
So, yeah, there's stigmatization. So it's actually a lot. So support group is one of the major things that people who are people have cancer can.
Okay, as a doctor and somebody who is passionate about creating awareness on cervical cancer, I need you to talk to some women like, you know, there are women, some women who would rather, you know, a woman is sick, a woman is not feeling fine, the woman would rather fake it. She would rather go and sleep in church for days. She does not mind sleeping on the bare floor. I'm not against miracle, and I'm not talking against miracle or talking down on your church. But you see, we also have in the Bible that you should give to Caesar what is Caesar and what is God to God. Now, a woman is sick, and the woman would not visit a doctor, would not visit a hospital, but would rather say, call my pastor or take me to the church. I was in a facility some time ago where a child was BID. You know, what happened to that child? The child suffered, I think the child was convulsing. And the first place they took that child to was church. And when water don't pass Gary, the way we say on the street, the pastor now advised them to take the child to the hospital. When I'm sure the pastor already know that the child is gone. You know, I said, okay, you cannot take her to the hospital. And the girl, it was a female child, was labeled BID, that is brought in there. And I feel so sorry for that child. Now, as a doctor, what would you say to this set of women who would rather go to church and sleep and cry instead of going to the hospital? Please just talk to them a bit.
Okay.
Maybe they will listen to you.
The first place, in fact, the major place you should go to when you have health conditions is the hospital. Just the way when you have issues with your phone, you don't take it to church, you take it to a phone repairer. Like everybody, if you want to make your hair, you do not go to the carpenter shop, you go to the hairdresser. Same thing, when you have health issues, please go to the hospital. Because this is actually a major issue. Cultural belief, like even some women believe that, oh, I need to tell my husband first. Wait, make I call my husband first before I would like seek for medical advice. Let me call my pastor first. Like people believe so much in their religion first. So when a child is sick, they take the child to the hospital. It's not only women, generally, like it's an African thing where people do not seek, they have poor health seeking behavior. So it is important that you should go to the hospital
But
first.
most of their pastors go abroad to seek medical attention now.
So as a person, as a mother, as a father, as a child, you need to go to the hospital first. Don't go to anywhere else. Yes, you can have, there's a place of spiritual belief in healing, right? But that's not the first place. That's like a support. So while you are taking your medications, while you are getting screened, while you are receiving treatment, then you can like pray about it and all of that. But go to the hospital and get your treatment there.
So how do we prevent cervical cancer before you leave?
Okay, cervical cancer is prevented through first awareness. People need to know about it.
Like
because a lot of people,
now?
they don't know about cervical cancer. So awareness, screening, vaccination, and then treatment.
Okay.
So these are the ways to prevent cervical cancer.
All right, Dr. Victory Uzoma, this is where I say a very big thank you for finding time to come join us here all the way from Agbo. Thank you so much for taking our time to be with us on the program today. All right, beautiful women out there, to prevent cervical cancer, please screening, 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 and screening is all you need to do. And stay away from multiple sex partners. For your kids who are not sexually active, between 9 and 15 years, please take them out for some vaccination against cervical cancer and so much more. I am not against you going to church. I go to church too. I'm not against you going to church. I'm not against you faithing whatever ailment you may have. But give to Caesar what is Caesar. That means go to church, go to the hospital and seek medical attention and then pray. After I see pastors go to hospitals to pray for patients and all of that. I see people carry their outreach to hospitals, even pay medical bills. All right, if they do not believe in seeking medical attention, I'm not sure pastors will go to hospitals to pray. All right, so do the needful for yourself as a woman. You know, give it to yourself as birthday gift every year to go do mammogram, cervical cancer. Just do a general body check and it does not cost so much, all right? At least I know of UBTH, their disease control center. Just go there and give it to yourself. Say, I'm treating myself. It's better than a piece of cake, I tell you, for real. So go do that and you will be fine. We'll see you again next week on the program. Bye-bye.
Yare.